Hi guys, my name's Adam. I'm a Student Recruitment Officer here at Stockton Riverside College. I'm here today to welcome you to your Careers in Health event brought to you virtually this year. Normally we'd have you in the college, but unfortunately due to current restrictions we're bringing it to you differently. So throughout the course of the event you'll be able to hear from our amazing course leaders for our Health and Social Care course, and they'll tell you a little bit about things like work placements, the careers you can go into, apprenticeships, entry requirements and the courses that we offer here. After that you'll hear from some amazing professionals from industry, so there'll be a range of different professionals from the health industry. So please do take the opportunity to take them in. If you've got any questions throughout the event, note them down and then just pass them on to your teacher or careers advisor within the school and they'll forward the questions to me. After the event, if you want any more information, just pop onto our website www.stockton.ac.uk and you can find all of the course information there. If you want to come for a tour of the college, you'll be able to book onto a one-to-one tour with myself, as well as other stuff like information on our open events, other events and stuff that we've got going on. You can also follow us on social media, so if you just go on Instagram and look for Stockton Riverside College, we post information on there as well about events and stuff. I really do hope you enjoy the event and get something out of it, so enjoy it and we'll see you all soon hopefully.
Good day everybody, I'm David Gardner, I'm the Programme Area Leader for Health and Social Care, and today I'm going to be talking to you about all of the career aspects you could go into for our area. When we're talking about this, I'm going to try and break it down for you for the level 1, 2 and 3 course more specifically, and hopefully at the end of it, if you've got any questions, you can get in touch with the college and we'll be able to address those. So the first thing is the breakdown of the college that I want to discuss with you. We've got the level 1, which is the key entry level, level 2 and then level 3. So most of you, when it comes to the end of your academic years in school, will be hoping to achieve the highest grades possible. So the level 3 qualification is what I would expect you all to be trying to aim for. So the level 3 qualification, what you need to do to get onto that course is you need 5 grade 4s and you need your maths and English where possible as well. And when you're looking at those qualifications, you need to make sure you especially focus on your maths and English, because when you get doing your level 3 qualification, obviously when you progress onto university, you're going to need those anyway, so make sure you're sticking into those in school when you're going to progress. When we're looking at the level 3 course, we break it down into what we call modules, and the modules that you complete in those in our programme, you've got communication, safeguarding, nutrition, working, health and social care obviously, and that's just to name a few. When we break it down into placements, you would do, so for the level 3 qualification it's a 2-year course. The first year you would do 75 hours placement, and the second year you would do 100 hours placement. And don't be worrying about that too much, then no, I need to find a placement before I come to the college. You don't. We've got a support system in place here at the college to support you getting that placement and linking it to what you want to do. Next up is external assessment. So we do, most of the information you do for the level 3 course is assignment based. So it's all done internally. All of our lecturers mark your assignments and that's how you get most of the majority of your grades. But you do have an external assessment in the first year and in the second year as well. And please don't be worrying about the terminology of external assessments, because over the last 3-4 years our results have been 100%. So we prepare you well for those. So please don't worry about that. If you don't manage to get the 5 grade 4s, there is the level 2 qualification, which you need 4 grade 3s or above to get onto. And exactly same, that's the modules are very similar and they're just stepping stones to get onto the level 3 course, and that's got no external assessment and no placement hours attached, but by the end of that year we do offer placement hours so you get prepared for the level 3 qualification. And then if you don't get For grade 3s, that's when you'd start at the level 1 qualification as well. So there's a clear progression, there's a clear platform for you all to gain the qualification that you need and to get on to your next steps. Health and social care is such a big area, and one of the biggest questions I always get asked is, what can I go into? And the job opportunities, it's just endless. So yes, we get a lot of students wanting to be a midwife, get a lot of students wanting to be a nurse, we've got social work, but we've also got other areas that a lot of our students go on to and want to progress, such as criminology, for example. Mental health is really big at the moment, psychology. So you've got a lot of options in health and social care if you're looking for a course that could potentially lead you in a variety of directions. Any other questions, please let me know and get in touch with the college. Thank you very much.
So my name's Kieran. I'm a freelance ambulance technician working in a private service, and I just want to tell you a little bit about working in health and social care and predominantly working in pre-hospital care. So to work in pre-hospital care, you've got to be a very patient-centred person. You've got to have good communication skills. You've got to be able to reassure people and show that care and compassion element of it. But you've also got to have a degree of technical ability in learning procedures, learning medications, and learning the different courses of treatment and referral. There's a wide variety of roles which you can do, which doesn't have to include just working 999 ambulances, responding to 999 calls. You can also work for private services, doing aeromedical repatriations, bringing people home from abroad who've fallen ill. You can also do event work, so working on festivals or working on sporting events. In football stadiums, like the Great North Run, for example. But to do all of these things, you've got a couple of different routes in which you can go down. So the first route is the university route, and to do that you would get your work experience, which is a massive part of the interview process. But then from there as well, you would need to get some kind of level 3 qualification, whether that be a health and social care course or an access diploma, and that would put you in good stead academically to be able to go and apply to university. But the massive key part of that is going to be the work experience, and the more relevant work experience you can get, the better placed you're going to be. Another route that you can go down is to work from getting a first aid certificate up to your what are called FREC courses. So that's your first response emergency care, and they're at levels 3, 4, 5, and your level 6 course is the paramedic diploma, which then allows you to go for registration with the Healthcare Professional Council. And they're more of a practical, hands-on type of course, whereby a lot of your placement is while you're working, and you'd generally be employed by a pre-hospital care provider privately to facilitate taking that course. There's obviously a lot of other qualifications you can do, and the length and breadth of the topic is absolutely huge. So you've got the opportunity, as I say, to do event work or repatriation work, but you can also end up working in primary care, in urgent care centres, and potentially even going into hospital environments whereby you're working in emergency departments or working in intensive care units. So there's a massive variety of skills which you can acquire throughout the course, and there's never just one destination. You can always choose to go down a different route depending on what your area of interest is. But one of the biggest things to say is to get as much experience pre-hospitally as you can. Go volunteer, go work on events, go shadow people, and apply for some private companies, get some work doing patient transport, and you'll be provided with all the training. And that's a really good way to evidence that you're interested in the field, ready for applying to these different higher level courses.
Hi, my name's Leanna. I teach on the Health and Social Care course. Health and social care is split predominantly into 2 parts. You've got your health side, which is your doctors, your nurses, and your social side, which includes your youth workers. I myself used to be a youth worker before I came to teach at the college. I worked in outreach and in residential youth work. I found this a very rewarding job because I was able to help a variety of children aged from 11 plus, although you can work with younger. We did things with them such as life skills, educational trips, and just basically giving them a place of safety to come to should they want to. I found it very rewarding as I was able to watch the child grow both physically and emotionally.
Hi, my name is Janet. I teach on the Health and Social Care programme. I'm going to talk to you about what we expect from our students. As you're going into a profession that requires you to be a professional person, there's a lot that rides on you. We do expect you to be having as much attendance as possible. We like you to have 100% if possible. Your behaviour has to be on a professional level, and the minute that you walk into the classroom, you become a health professional at the very lowest end of the scale. However, we do prepare you to be the professional person that you will eventually become. Now, we do have very high expectations of our students because of the profession that you are going into, and this means that your attitude has to be positive. You need to want to be the best person that you can be. Your behaviour should always be exemplary, as would be expected from a professional person, and your commitment to the course and to your future career is very important to us as well as to you, which is why we put a lot of things in place that will help you to be successful in your chosen career path. Student feedback is very important to us as well, because we want to give you the best experience, and when you do qualify, that you can say college was the most positive experience that's taken you through to your future on your journey. You do have a chance to give some feedback, whether you want to give it verbally, in writing, or if you want to participate in our student surveys and our principal forums. We do have a voice for our health and social care students. It is literally all about you. You are the most important thing to us, because we know that one day you might be caring for us and our families. Thank you.